Okay, we're going to talk about Gracey Curets today. So if you remember from before, a curette, like the universal curette, has a rounded toe rather than a pointed tip. And then it's also got a rounded back. And so for these, when you're thinking rounded toe, rounded back, okay, these can be used subgingivally. And Gracey's are specifically designed to be used subgingivally. Their shanks are longer, and then for the posteriors, they have really complex shanks made for reaching back to the back to get around tooth surfaces and to adapt better for you. With them being called area specific, that's different than a universal. If you remember with the universal, those can be used universally throughout the mouth. They've got 2 cutting edges per side that we use, whereas area specific, just like the name says, can only be used in specific areas of the mouth. So there's going to be a difference here. So if we take the buccal of number 30 with the 7/8 universal, you could have treated that whole buccal side with one end of your instrument. But with the Gracey Curets, that's not the case. It's going to take 2 instruments to treat that whole side. And so with this, the reason why these are important, even though it does take more than one instrument to do what you need it to do, with them being self-angulated, which we're going to talk about in just a minute, some of these bends and turns and longer shanks and then the self-angulated blade are very nice and useful, and people like to use these, especially for periodontally involved patients, because you're going to find, I think, that it's going to adapt a little bit better for you and fit down into some of these deeper pockets better for you than some of the other ones would. And so when I'm talking about the blade, I'm going to show you what I would draw on the chalkboard for class. So we've got this tooth over here, and this is what I want you to look at. So if this is our terminal shank going straight down, and notice that that terminal shank is parallel to the long axis of the tooth, or in line with the long axis of the tooth. Another way to talk about that, and I'll show you in a minute like on the actual typodont, is pointing toward the tooth if you set it on the occlusal surface. So I'll show you that. So with this terminal shank, rather than having a flat face, we now have a tipped face or a tipped blade. So if you remember our scaling strokes and trying to get that 60 to 80 degree angulation, this blade is made with a 70 degree angulation. So it's called self-angulated, like it's doing the work for you. So your main goal is just to watch and make sure you're trying to keep that terminal shank parallel to the long axis of the tooth. Then the instrument should be adapted anyway. That's why that's nice. It helps when you're down deep in those pockets. And so then you'll hear us talk about the lower cutting edge. That's this right here. It's that side that's tipped down that we're going to use to truly work on the tooth. And so when you insert this instrument to start scaling, you are going to try to get near 0, but it's not as big of a deal now because it's already tilted for you. So your angle to like insert into the tissue is not going to be as much over toward the tooth as it used to be, because this is doing some of it for you. Things I think about with Gracey's typically are grainy Gracey. Like that's what I remember in my mind is grainy Gracey, thinking regular Gracey's are going to be used to root plane. It's going to be like a little bit longer stroke, less pressure to clean off those root surfaces. So that's what a normal Gracey is used for. But there are different types of Gracey's. There are after 5 Gracey's. And so those have an even longer terminal shank so that you can fit deeper down into pockets. There are mini Gracey's. And what that means is that end blade, let's see here. This blade right down here is smaller. That's what a mini means, is it's smaller. I think of that for being really nice to fit into some of those root concavities that some of the teeth have. But they're also called rigid Gracey's, and that's what you all have in your cassettes. And so a rigid Gracey can be used to root plane with lighter strokes. However, with it being rigid, that means the shank is bigger, less flexible. And so it's able to withstand more pressure from you pressing. This means that it can remove moderate calculus. So you've got the benefits of it being able to adapt to some tricky periodontal spaces, but then also a thicker shank so you can actually press harder and remove more calculus. Let's see here. Got my other paper. So then what we need to talk about are the different types of Gracies. And so you've got an anterior Gracie. That's this one right here. And so see where it's got the straight shank and then just the blade on the end. So automatically with that straight shank, you're gonna be thinking, okay, this is probably an anterior instrument because it doesn't have all of those bends to try and reach to the posterior. So that one is called your 1-2 or anterior Gracie. Then you're gonna have posterior Gracies. And so now it's gonna take a set of Gracies to finish the one side of the tooth. And so you've got a 13-14 and a 15-16. And so you can see the difference here between the two where this is straight and then these have lots of bends and curves in them. And then see that long terminal shank right there? You know, that's there for a reason so that it can fit down in those pockets. When you look at a Gracie, we're gonna start with the anterior Gracie. You are looking for the lower cutting edge like we talked about before. There are different ways of doing this and everybody kind of finds their own way. You're looking for the side where the blade is tipped down or the face is tipped down so that you can find that lower cutting edge. So some people will place the toe facing toward them and they'll look at the face and turn it a little and look for which side is slanted down. So I know that this side right here is my cutting edge because it's slanted down. Another way to do this is the way I do it, is I actually turn the toe away from me. And when I look at it and I turn it side to side, so I'm gonna turn it side to side. So this side, I can see the face. Like I've turned it toward me and I can see the face and I can see it slanting down. So I'm positive that this is the lower cutting edge side. However, I'm gonna check the other one just in case. So now I turn it the other way and all I see is the back. So I know that's not my cutting edge. So I'm gonna go back here and then I know that this is my cutting edge on this side. So that's how I find it on this anterior Gracie. And so now I'm gonna move this over to the tooth and to the mouth and show you some things about scaling. You're still gonna use your surfaces toward and away. So a lot of those basics as far as chair positioning are gonna be the absolute same with your Gracie. What I really want you to be careful of with this one is you've got to make sure you've actually got a cutting edge on the tooth. That's where I watch people where they struggle, you know, on PEs and OSCEs, is they'll just get going and then they kind of forget and they don't actually have a cutting edge on the tooth. So I wanna make sure, especially at first, that you're truly checking to find that lower cutting edge. And so for here, I'm turning it, I've got my lower cutting edge on this side. So then I know if that's my lower cutting edge, that's what's gonna work on my surface away. And so if I'm up at 12 for my surface away, I'm gonna insert a little bit near 0, but remember that doesn't have to be as much now since it's angulated. And then I'm gonna tip this up to where my terminal shank is in line with the long axis of the tooth. I've still got my fulcrum, just like before, and then I'm gonna scale. So sometimes with this instrument, you don't necessarily adapt to the tooth automatically, so you want your terminal shank basically straight up and down with the tooth. But I will say every once in a while, it takes a little bit of fulcruming one way back and forth with my, with my fulcrum finger to move this just a little bit because I'm watching and I'm feeling now. Because, I'm trying to see if I'm in a spot where it is truly grabbing onto the tooth and doing something rather than sliding across. And so it may take moving your hand back and forth just a little bit to actually get it to where it's adapting. Also, if it's completely sliding across there and you feel like you're not getting anything no matter what you do, recheck your working end because you may be using the wrong end where you don't have that lower cutting edge. Third thing, if it's still not working, then you might need to sharpen your instruments. So remember that too. So we've got our nice controlled strokes in here. And again, it depends on what you're doing. If I'm removing calculus, then there's more pressure like this. But if I'm root planing, it's going to be lighter. It's still adapted, but it's lighter. As far as this direct facial right up here, this is what I want you to not ever do. So don't use your lower cutting edge here. Come out and turn it and go across like this, because at that point, you do not have the lower cutting edge. You are not using a blade across here. What I like to do is scale here, and I do like to scale this direct facial from 12 o'clock, but once I'm done here, I flip instrument ends, so now I've got my lower cutting edge truly across that facial. And so you can go deep down in here, and you can use lateral pressure to remove these things. Your short strokes, because a lot of times on these teeth, they're small up front here, but this fits really nicely down in there. And then when I get for my surface toward, which this depends on if you're left-handed or right-handed, so you've got to remember your chair positions. You know, for your surface toward, left-handed, I'm going to move down to 4 o'clock. The surface toward for a right-hander was the one I started on, so you're going to sit at 8 o'clock. So if I was using that cutting edge this whole way going this direction, it's going to be the same cutting edge for this side. And so I'm going to use this the same way right here. And this works the same way for your linguals too. You just have to make sure that you've got a cutting edge on there. And then as a reminder, your pressure is on that pull stroke, or that stroke that is away from the tissue. Okay. So now we're going to talk about posterior Gracies. So I'm going to move this. Okay. So one thing I want to call to your attention before I show you on the typodont is this terminal shanks. We're going to talk for a few minutes about some of these posterior Gracie things. You know how I talked about the terminal shank being so long with this instrument? So I've got it like this. This is my Gracey. This is a 5.6, the 5.6 universal. And if you remember last week, compared to the 7.8, we were saying, okay, this has a longer terminal shank than the 7.8. However, I want to compare it to a Gracey. Let me see if I can get this to where, let's see. There we go. So this is my Gracey over here. This is my 5.6. Do you see the difference in those terminal shanks right there? So there's a decent difference with that Gracey having an even longer terminal shank to be able to fit down in there even more. And so let me turn this over to, I've got my picture here. For posterior teeth, what you're going to learn is that you have a posterior instrument and then an instrument that cleans or scales the direct buccal and the direct lingual, and then also the mesial. So we call it a distal instrument and a mesial instrument. I'm going to show you on the mouth so it makes a little bit more sense. Your 13-14 is your distal instrument, and then your 15-16 is your mesial instrument. And so when you look at a tooth, let's see here, if I can get this up here. There we go. So we divide it like, kind of like exploring, you know, but like the other instruments too. Like think about your sickles and universals where we're paying attention to that distal line angle. And so your distal instrument is going to be used on these distal sides. So that would be your 13-14. You insert underneath the tissue and then adapt. And then as you're going across the front of the tooth up here, like right here, as you're going forward, you switch to the mesial instrument or the 15-16 and go across the front. And then for the mesial, you insert near 0 and adapt and scale the mesial. What I do want to call your attention to, though, are roots. And so the way to remember how to treat roots with Gracey's is to treat each root as its own separate tooth, because the distal side of the root is going to use the distal instrument, or the 13-14. But the mesial side of the root right here is a different side. That is going to use your mesial instrument, or your 15-16. So then, what I want you thinking with posterior instruments is always paying attention to the terminal shank and the lower cutting edge. I'm sorry, I'm moving this a bunch. I'm trying to get it really close here. So I'm going to start off with your distal instrument, the 13-14. And think about this like the Explorer. I mean, as far as trying to find the correct working end, it's just an exaggerated version of the Explorer. I'm going to stick this in here right now like this. Let's see here. Let me turn it just a little. Okay. And so I'm going to stick this in the distal, and this bend points out of the mouth. It wraps around the front of the tooth. So that is not my correct working end. However, if I stick this in the distal here, do you see where my terminal shank is now parallel with the long axis of the tooth, or the bend is toward the back of the mouth? And then another way to think about this, like we literally just figured this out this week to look at it this way. If you sit this Gracey, if you've got the right one and you sit it right on top of the tooth, the terminal shank of the correct end is pointing straight down toward the tooth. Whereas the incorrect end, the terminal shank is like laying sideways. So then the way you're going to use this is you're going to get your fulcrum, insert in your 0, lift up, watch so that that terminal shank is parallel to the tooth, and then apply pressure. Then that's all we can do with this particular instrument, because it is the distal instrument only. So now I'm going to switch to my 15-16 and do the same thing. The terminal shank is pointed down toward the tooth. From here, it's up and over. The bend is toward the back. For here, it's wrapped across the front. It's not in line with the tooth, so that is not my correct end. So I'm going to take this one now, since I know this is my mesial instrument, and I'm going to adapt across the front of here and scale. And then I'm going to stop once I get to about right here. Some of this is kind of hard when we're pretending and we don't have true calculus, but I like to divide the tooth up into 3 sections where I've got a distal, a direct, and a mesial. So then once I get to about here, then I'm going to readapt, insert near 0, lift up to where my terminal shank is parallel with that long axis of the tooth, and scale. So no matter where you are in the mouth, this instrument is going to be my mesial instrument. So if I jump down to number 30 down here, it's going to work, but now that's not the right working end anymore, how it's laid across there, whereas it's my opposite end that's going to work now. So I use this the same way, just different end.